Hello, welcome, and thank you for being part of WorkSafe's Using Systems Thinking to uncover the factors driving manual handling and mental, psychological injuries in Victoria's public hospitals webinar. My name is Cameron Ling, and I'll be your host for this session. And today I'm joined by two WorkSafe experts, Dr. Mohammed Abdurrahman, Senior Ergonomist, Health and Safety. Dr. Abdurrahman is a human factors specialist with a consulting and research experience across a broad range of industries specialising in systems and organisational human factors. Welcome to you, Mohammed.
Thanks, Cameron, and hello, everyone.
It's great to have you with us. Also joining us this morning is Pia Chaveri. Pia is a social worker with experience in the statutory, community and local government sectors. Pia joined WorkSafe in May 2022 and is currently the Program Manager for Healthcare, where the portfolio focuses on prevention of injuries and fatalities in that sector. Welcome to you, Pia.
Thanks, Cameron. Good morning.
Good morning to you. Thank you to both of you for joining us today. And this morning, we'll discuss the recent WorkSafe Systems Thinking Analysis and Recommendations, or STAR project, which focused on prevention of manual handling and mental psychological injuries in Victorian public hospitals. We will unpack the methods and benefits of undertaking a STAR analysis and introduce the key features of STAR: systems thinking, collaboration, prevention, and regulatory excellence. And we'll walk you through the fundamentals of systems thinking and how they help us to understand and improve OHS performance in complex systems composed of human, technical, and social elements. We will explore the following key topics with our speakers: what a STAR project is and how it can be applied across different workplace environments. Also, how STAR enables stakeholders to identify system-level prevention interventions, and also the power of a systems thinking approach to workplace physical and mental injury prevention and mitigation. Let's get started. I'd like to start with you, Mohammed, if I could, to explain what systems thinking is. And could you briefly outline how it works to mitigate health and safety hazards in your workplace?
Absolutely, Cameron. So systems thinking is a philosophy that, when used in the occupational health and safety context, helps us understand and improve OHS performance in what is called the complex socio-technical systems. So these are systems that are prevalent in modern societies. We see it in workplaces, from healthcare to transport to energy, almost everywhere around us that we see it. These systems are composed of both the social and the technical elements or components. In social being the individuals, the organization, the work teams, the technical part being the work environment, the physical environment, the equipment, the technology, both the hardware and the software elements of it. And then these systems, or within that system, these elements, they interact and they're interconnected, they're interdependent as well. So a change really in one part of that system can have a ripple effect throughout that system. So back to systems thinking, it involves us studying and exploring the characteristics of those components within the complex system, and analyzing and understanding really the relationships and the interconnectedness and the interactions that are happening across that system, and understanding how outcomes emerge from these interactions, and then form views and decisions about occupational health and safety accordingly.
If I could stay with you, Mohammed, for just a second, I wonder if you could explain why systems thinking is such a powerful tool in prevention of injuries in the workplace.
Yeah, so first I must emphasize really the importance of using an appropriate model to understand why workplace incidents occur, because essentially that model of incident causation that we adopt determines what are the factors that will be seen as the causes of those incidents and what other potential factors might be ignored by that model. So within, one of the limitations of traditional incident causation models is that they're inadequate in really capturing the dynamics and the non-linearity, within those complex socio-technical systems, how those components within it interact. This brings us to really one of the most popular systems thinking models that we use within, in systems thinking is called the Rasmussen's risk management framework, which is now one of the more widely accepted, methods within systems thinking. And it is also widely accepted as one of the most appropriate approaches for understanding and preventing incidents from work systems. That model really represents the work system as a hierarchy of different tiers. So it looks at the things that are usually emphasized in previous incident causation models. That looks at the frontline levels, it looks at the work levels, the management levels, but it also extends that thinking beyond, and it looks at some of the external factors, the external pressures in the system, the government policy impacts, the budgeting impacts. It looks at various external pressures that are happening across the system, the regulatory environment, and so on. And that really helps us in understanding all those interactions that are happening and how those are driving those contributing factors that we're seeing at the frontline levels. And that comes with the appreciation that we come with systems thinking, is that there are always multiple interacting factors that contribute to incidents and not just a single poor decision or an action.
Thank you for that, Mohammed, for that explanation. I think now's a great time to reflect back on the poll results. Thank you to everyone who has got involved there. The question we were asking was, how do you apply systems thinking in your OHS workplace practice? And the results are interesting here, Mohammed. Nearly 50% of people who have responded are saying, I'd like to know more. And then you throw in about 30% we use it in our OHS strategy development, but I'm sure we could do it better. And then it's combined around about a quarter of our participants have either, I've never heard of it, I think I've heard of it, but I'm not sure how we could apply it. How do you react to those responses we're getting from our audience right now?
Well, I'll say that it's not unexpected. We see that quite commonly, and that's, I think, because it's still very common, and we see that everywhere we go is the traditional incident causation models are still quite commonly used. But there's definitely an appetite for systems thinking that we're seeing nowadays. And hopefully by the end of this session, we'll be able to guide you into some more resources and getting more help around applying systems thinking in your workplace.
Absolutely. Thanks for that, Mohammed. And thank you again for everyone who got involved in that poll. A lot of people participating. I'd like to move to you now, Pia, if I could. I mentioned STAR earlier. What is the STAR and how can it be used to make workplaces safer?
Thanks, Cameron. The STAR was a term that we used to describe the process we were going through in this particular project. So STAR stands for Systems Thinking Analysis and Recommendations. And as you can see, there's a big emphasis on the systems thinking, but also that analysis part where we really wanted to explore where the points where we could make interventions could be. And we wanted to do that collectively and collaboratively with stakeholders who participated in this project. And obviously from that, we can find ways to either make recommendations or considerations for future ways of working in the healthcare system.
Staying with you, Pia, so just how does a STAR project work and what does it achieve from this approach?
Great. So it's a very comprehensive and collaborative approach in this instance because we were working with the healthcare sector broadly, which meant that we had numerous participants in our workshops. And what we did was draw with the support of obviously an ergonomist like Mohammed here. We were able to draw upon the experiences of people working in the field to identify all those points where there were problems or hazards or pain points that were arising and causing risk in the workplace. But at the same time, beyond that piece of work, we were able to then look at the points at which we could also prevent at those exact points where the pain points were arising. So it's comprehensive, it's multi-layered, and as Mohammed has said, it takes you through all the layers of an organisation, right through to the way it's funded, the policies that surround it, both internally and externally, the way that healthcare is even perceived in the community in which we live. So it actually has a very broad perspective rather than just looking at the very narrow view of a mistake made in a ward with one particular worker involved.
Well, on the back of what P is talking about there, Mohammed, if I could jump back to you, what are the features of the STAR approach that makes it so potent?
Well, there are a few features of that STAR approach that really makes it quite effective. The first one is going back to the systems thinking bit is that it is a systems thinking approach. So it really provides us with a lens that offers a more accurate picture of the systems of work. So it's around the principle of what you look for is what you find, and what you find is what you fix. It also gives us a set of practical tools, evidence-based practical tools such as the AXIMAP, the preventive map method that allows us to improve the quality and efficiency of our work. It also allows us to apply that lens for a broad understanding of a specific concern or a group of concerns within a sector or a group of employers. And it also, allows us to identify the interconnected, contributing factors across and within all system levels, those system levels that we talked about, including how that concern is being impacted by the decisions and actions of everyone in the system. Another feature is that it is quite a collaborative approach. So we do a lot of consultation as part of that with both internal and external key stakeholders, such as the regulators, the employers, the employees, external influencers, and so on, to ensure that all views are being taken into consideration and just gain that overall understanding for the barriers and the facilitators from those various perspectives within that socio-technical system. It also allows those stakeholders by engaging and collaborating with them from an early a timeline within that project. It allows them to shape up and refine the scope of that project. And throughout the project, we would have engagement with stakeholders through, workshops. It could be interviews, focus groups, surveys, and so on. And then the last feature that I want to touch on is really that preventative approach. So it allows stakeholders the opportunity to provide input into prevention strategies to mitigate those contributing factors that we identify across the system levels. And those are then used to inform and guide future potential interventions that could be used to address system-wide improvements rather than focusing on localized and individualized interventions.
Thanks for that, Mohammed. Back to you, Pia, on this one. WorkSafe has developed a fabulous practical way of applying findings from the STAR process, focusing on prevention of manual handling and mental psychological injuries in addressing OHS in the healthcare setting. Healthcare is a notoriously complex workplace. Could you tell us a bit about the project and what you did?
Sure, thanks, Cameron. So I've already touched on it somewhat in that we drew upon the knowledge and wisdom of the sector with whom we're working. So it was a collaborative approach in which the scope of the project was to look at manual handling and mental injury and the factors that drive those in that healthcare setting in public hospitals. So we drew together 200 participants across 33 different organisations and ran numerous workshops. We ran 8 in total. And in the course of those workshops, we focused initially on, as addressed earlier, those pain points. So looking at where are the pain points in this system of work in which the outcome are then manual handling or mental health injuries. And then from there, we were able to come back, continue doing workshops in which we then looked at the sort of opposite perspective, how are we going to intervene at those points and prevent the same kind of pain point from occurring in the future. So the focus is very much on prevention, although it can be used to map when an incident has occurred as well. But essentially what we're trying to do is look at how the entire system of work contributes to a poor outcome, because actually just focusing on that pointy end where something's happened, where there's been an incident, is actually not the solution to the problem. The problem has started a long time earlier, back through that system that we've touched on, and that includes all those factors that both Mohammed and I have talked about already, going through to all those layers of an organisation or a system. It includes funding, it includes policies, it includes particular directions that are taken in sectors such as healthcare at different times. So all of that actually is influencing the work that's done on the floor, and we want to prevent further injury from occurring at that point. So effectively, this was a way of trying to find all those opportunities to ensure that we could prevent in the future.
Great, thanks for that, Pia. Mohammed, STAR is now a tool that healthcare and other sector workplaces can use to address these complex OHS problems in their workplace. What elements of the STAR make it so flexible and, I suppose, adaptable across a range of other workplace environments?
Absolutely, Cameron. So STAR is really a very flexible, very scalable approach that we use, and it can be almost applied to any problem in any industry or even within a single workplace. The methods that we use, the tools that we use, such as the actor map or the axis map or the preventive map, they can be tailored to almost any context. So it can be from addressing a specific incident or a specific concern at a specific workplace, just looking at one incident in isolation, all the way to looking at a broader concern amongst, like a whole industry or a whole sector. So it's all about setting clear aims, expectations, and a very clear scope for the analysis. I think I need to emphasize that point, because that really dictates how we tailor the methods that we use, and the data collection methods most importantly, because within the data collection methods, we need to set clearly how we are going to collect the data to conduct the analysis to obtain the outcomes that we get. So it can be from a range of, looking at qualitative one-on-one interviews to doing surveys or even reviewing incident reports to come up with those contributing factors. But then when we come to the prevention side, it's always about, the consultation to get and gather those views to map them out.
And how important is that consultation along the way?
Absolutely, it's quite vital. As I've mentioned, it's one of the features of that approach. It's built on the collaboration and contributions of those key stakeholders from across all the different levels of that system. Therefore, it creates more opportunity for extending our thinking around the challenges and finding the solutions in workplaces from those various lenses, all the way from people on the ground to the decision makers or the policy makers or people who are responsible for the funding, within those systems. And as I mentioned, within an organization that participates with us, it happens all the way from frontline staff to the senior execs to even external influencers. Sometimes, the views from the unions, from the associations, the employer or employee associations, and so on.
Pia, can I bring you in here? Is the STAR you've used in healthcare something that can be used easily and simply in real life scenarios? Are its processes specifically time consuming or expensive to implement?
Sure. Definitely it can be used and applied in other settings, in all kinds of workplace settings. The trick, I think, is to understand the systems analysis process. And so obviously I would always recommend engaging services from human factors or ergonomists, specialists like Mohammed, because those practitioners are trained to understand that particular theory of practice, and I think that's a really invaluable contribution that can be made. In terms of time-consuming, yes, in some ways it's time-consuming in that it's methodical and very, it takes time. Like, it's not something that can be applied and worked on, within days. It really does take weeks to months, in our case, probably close to a year, to really get the right information, the right pieces of work pulled together, the right people in the room to then be able to come up with the next steps, which is the analysis of what it is that has been discussed. I would say, though, that that's priceless in many ways, because without it, the risk is that you just keep dealing with those incidents on the floor, whatever that setting might be, and you can remove that particular incident in whatever way you want to do that. But if you've got the system still doing the same thing, you'll have a repeat of the incident over and over. So in fact, you won't actually save time or money in the long run. So from my point of view, it does take time. It might cost money. In our case, obviously we have the resources within WorkSafe, but in another setting, you may not. But at the same time, as I say, the price of prevention is always going to be preferable. There's an economic cost, but there's also the human cost. So we want to eliminate the chance that people are actually injured at work. And the best way to do that is to invest in prevention in the first place.
I wonder, Pia, have you got an example for us on that?
Yes, sure. So if we looked at, say, if we go back to a hospital setting, we could think about where there's been an accident on the ward, like wrong medication administered, for example. So one model would look at all the things that practitioner, the nurse in that instance, might have done incorrectly. So we can zero in on the nurse and say, this nurse has made a mistake, this nurse didn't check something, this nurse has now given the wrong medication, there's been an adverse outcome for the patient, and we could take a number of different courses of action. We could train the nurse, we could remove the nurse, we could take a whole lot of very individualised approaches. But if we don't look at why that happened from a systemic point of view, then the chances are it will repeat. And by that, I mean, we might have an example where the nurse was fatigued because the actual work system was creating the foundations for fatigue to be occurring across that workforce. That could be through rostering, through shortage of staff, through the way the work is being expected to be done. So if that doesn't change, you will continue to have nurses at some point making a mistake on the floor because they're actually fatigued, which is something that's not in their control. So in that way, I would consider that the prevention of that by going further up the system to look at how do we ensure that the rostering's adequate, how do we ensure that we've got the right numbers and ratios of patients and staffing, etc. There's a whole lot of ways that we would look at that to try and prevent injury from occurring. And again, I think with OHS, I want to really emphasise as well, we are talking about human lives. So whilst there's always economic implications, the baseline is that we don't want anyone injured at work.
Absolutely. Appreciate that example you've given there, Pia. Mohammed, if I could come back to you with this one. What happens after the STAR process has been completed?
Yeah, so that's a great question, Cameron. I think I need to emphasize, the importance that STAR as a piece of research by itself doesn't really lead to changes or direct changes in outcomes by itself. Yes, it leads to, probably greater awareness, greater knowledge around systems thinking and the tools that we apply, also around some of the issues that are happening that we identify throughout that process. But it's important to emphasize the implementation of those findings and those recommendations or those outcomes that come out of that STAR project is really what leads to change within the sector or the industry in which we've applied it. So it's quite important that we have buy-in from the stakeholders. We continue the collaborations that we initiate within the project moving forward to progress the work that arises from the STAR project. And it's quite important, one of the more important steps is that there needs to be a working group that is formed to progress and monitor or track the STAR actions that are happening, those preventive maps that we produce. And including part of that process, there needs to be a prioritization of those recommendations. So looking into the preventive maps, identifying what are some higher priority actions, what are some short-term actions that we can take, and what are some of the longer-term initiatives. So essentially building a roadmap for that industry or that sector for 5 years, 10 years, or so on, and working throughout those goals and progressing those initiatives. And then eventually those initiatives really take a life of their own. It becomes, each initiative is a project on its own. And then one last point that I want to emphasize here is the importance of consultation at each and every step of the way as part of that process.
Thanks, Mohammed. Back to you, Pia. Your project focused on healthcare. Could you explain the misconceptions that some of the audience may be facing in their workplace? What myths would you like to bust?
Well, certainly in healthcare, I think there can be a perception that it's too big and too unwieldy to actually effectively address. And I strongly disagree with that premise. I understand why people will think that, but I think that that's not going to help us in the long term, given that most of us, if not all of us, will in this journey of life experience the healthcare system somewhere between our road from birth to death. So we are going to experience the healthcare system. It really is fundamental for a society to have a very robust, very healthy healthcare system that serves the population. And that involves making sure that workers are kept safe as much as patients are kept safe. So in saying that, I don't think it's impossible at all to resolve many of the huge and significant barriers that we do see in healthcare that can cause harm and injury to workers. I do think that it takes a will and it takes resourcing and it takes some of those layers that we're talking about in the system to change, but definitely it is something that can be achieved and in fact that we should be striving for as a community.
Thanks for that, Pia. That's great context for our friends joining us from the healthcare sector today. Your project report is almost complete, Mohammed. Could you give us an overview of your findings?
Yeah, absolutely, Cameron. So without really going into a lot of specifics around the findings, because the report is currently under approvals, but really what we did was we broke down. So when looking at the manual handling side of things, we broke it down into themes or thematic clusters, what we call, and we looked into issues such as staff availability and workload. We looked into learning and competence, and we looked into the environment and equipment related factors as well. And on the flip side, with the mental or psychological injuries, we looked into high job demands, looked into occupational violence and aggression, and looked into bullying. And really, we uncovered or explored a variety of different factors from the contributing factors to incident, on the flip side, looking at the prevention side of things within the preventive maps, and looked into a whole range of issues, from the facility design to the, impacts of things such as COVID, to the workforce shortages, to the guidelines and so on. But yeah, the report should be out soon, and hopefully participants today can have a look and explore some of those really specific findings that we have.
Great. Looking forward to seeing that report, Mohammed. Thank you for that. But continuing on with you, what would you like our audience to remember from this morning's session?
Well, thanks, Cameron. I think it's quite important that the use of an appropriate model to understand why workplace incidents occur, such as MSDs and mental injuries in this case, it cannot be understated. So it's important that we apply or understand that principle of what you look for is what you find, and what you find is what you fix. And then I also want to emphasize the principles of prevention upon which STAR is built. So it's around that shared responsibility of the actors across the system. It's also about understanding that there are those multiple interacting factors that contribute towards incidents, and it's not just one single, human error or a specific failure that happened within a system. And it's also about the vertical integration and the importance of creating those feedback mechanisms and the consultation that happens across the system. So it's important that what happens at the frontline level is informed by the decisions that are happening upwards, and whatever decisions that are happening upwards at the system are being fed by what's happening on the ground, on those real difficulties that are happening. And then just finally, a word on the pressures that are created in the system. So the system adapts really because of those pressures that are happening. So it's very important that we monitor for the erosion of the risk controls within the system, and we adapt accordingly. And then just the last point that I want to touch on is that we're in the process of creating or conducting more STARs, and we encourage large employers in particular to adopt a systems thinking approach to incident investigation. And those who are new to the methods, I think it's quite important to learn more about it. Hopefully, we've given you a little bit of a brief, and then once you look into the report and learn more about systems thinking and understand that it's quite flexible. Although there are complexities involved, but it can be done at a simple level when looking at specific incidents, and understand that from a broader perspective than what traditional incident causation models have offered us.
Just quickly, Mohammed, where do we get more information on that?
So hopefully we can expect the report to be out soon. But for those who would like to know more today, we have done the STAR project previously. So we have on our website the systems analysis for occupational violence and aggression within the residential out-of-home care sector. And in that report, we go through a lot of the theory behind it and explain the methods. And then it can showcase it is a case study that shows how we've applied that method practically and along those different stages of that STAR project, all the way from looking into the contributing factors, looking at dividing it into thematic clusters, and then looking at the prevention side of things. So hopefully that can lead them to get an appreciation of the practical side of how that STAR approach is done. And it also has some references in the report. So if participants are interested to know more, they can go and read more about some of the literature around systems thinking.
Great. Thanks for that, Mohammed. And thanks to both of you for everything we've been talking about today. I'm hearing that the impacts of efficient systems within workplaces cannot be underestimated. And on the other hand, the effects of inefficient systems can cause injury and unfortunately even fatalities. The STAR research as an exemplar of systems thinking in action can be a powerful tool in every situation and workplace environment. I'd love to get to some questions now from our audience. We've got a number coming through. Really appreciate everyone who's getting involved with that. I'll try and direct the questions as best I can, but please, either of you feel free to jump in here. I'll go straight away to this one that a number of people want the answer to. Is there a template or a format document / checklist which can be used to implement the systems thinking and the STAR process? Who's best to answer that one?
I'm happy to take that question, Cameron.
Go for it.
Yeah, so Cameron, as I mentioned, it's within the reports that we issue. So in this case, we have the out-of-home care report, which is already out. It goes through those methods, and within those methods, it's quite easy accessible. The Action Map template or the Preventive Map template, because it goes through the references, the evidence base through which we collect these methods, and then there's also a lot of research that's out there that's looked into a number of different OHS issues in a number of different complex workplaces. So there's already work that's been done. I know within WorkSafe, we've also previously looked into, we've done the FIRES project. So it looks at patient handling injuries in healthcare. And there was a very detailed incident investigation toolkit that was produced as part of that. And it really goes through sort of like a checklist type document around investigating those incidents. And hopefully, very shortly as well, I don't have a timeline on that, we're also going to be launching what's called the STAIR, Systems Thinking Incident Review tool, that is going to be dedicated for healthcare at the moment, that is going to also be giving a set of practical ways and a practical tool. It's also an electronic tool that's going to be used by employers to investigate OHS incidents.
That's great. Thank you, Mohammed. I might steer this one to you, Pia. What's the difference between systems thinking and a safety management system?
That's a good question. And I would say that whilst there's similarities, my view is that the systems thinking it encourages because of the descriptions that Mohammed's given us about the ways that you look at the particular systems or incidents in a workplace, it encourages a very, like a very broad but very comprehensive and collaborative view or perspective or research even into those points of what has happened. So whilst it's similar, I think that it's still encouraging maybe a more, what's the word, like a more lateral view of trying to really understand what has happened in that workplace, as opposed to safety management system, which might be a little bit more prescriptive in some ways. I don't know, Mohammed, if you've got another view to add to that.
Yeah, I think if I can just emphasize that, within systems thinking, within this context that we apply, we're looking at the incident sort of investigation and the learning from incident process and understanding what happened wrong. So I think it's quite encompassing. I think it's much broader the way that we apply systems thinking to what safety management systems are. And I think safety management systems is really just one element of those components that we talked about that we explore within systems thinking.
Great. Thank you to both of you there. Maybe I'll continue on with you on this one, Mohammed. Given the benefits of a systems-based /HF approach to safety, could WorkSafe consider providing information about this on their website?
I think that's a great suggestion. And HF here, it's human factors in this context for our audience. So I think that's a great suggestion, and hopefully that's something that we can work on. The tools, as I've mentioned, the methodology and really a more thorough explanation of those tools is provided in the report, but it's not really easily accessible unless you go into that report. But I think that's a great suggestion, and hopefully we can take that on board.
Pia, this one I think I'll direct to you. What resources will WorkSafe provide as an outcome of this work to support the healthcare industry?
In terms of this specific piece of work, I'm understanding that to mean. In terms of resources, as Mohammed has said, for this piece of work, we are still working through the approvals of the report. The purpose of the collaboration was that WorkSafe itself doesn't own the piece of work. It's something that the sector itself can refer to and use in its own settings. So whilst there will be some resources, no doubt, that arise from the report, there will be also plenty of points or suggestions within there in which actual individual workplaces can also pick out some of those interventions and consider applying those. The purpose is really that it's creating an opportunity and a resource for food for thought for the sector to have a look at, and the idea was really that the participants who collaborated in that workshop all have an investment in applying some of those interventions or prevention strategies that have been identified.
Peter, I'll get you to continue on with this, but Mohammed, please feel free to jump in. What's the best way to get started on applying systems thinking to OHS in my workplace?
Yeah, that's a really good question. I think it will depend a lot on the type of, like the size of the workplace, the complexity of the workplace. So I think the starting point would certainly be around that mapping. So I think, as Mohammed has said, potentially looking at some of the existing material that's available on our website. So there's the OVA STAR in out-of-home care as one example. I think mapping it and then having an understanding of who needs to be brought in, like who are you going to engage in that process. And again, depending on the size of the workplace, it will vary as to the comprehensiveness of how many people are involved, or whether or not you're looking at something that might be across different sites, etc. I would say that you always need to consider people from all the layers of the workplace, because whilst we have people in levels of responsibility to coordinate or facilitate teams of work, etc., we also know that those people working on the floor will have particular expertise and wisdom around the reality of how different suggested prevention strategies may or may not work, or even where some of those pain points are. So to me, you need to also be engaging in an organisation where there are hierarchies. You need to be engaging all those layers to ensure that you're getting that very dissected view of how the work is done and what can be done to maximise the benefits of a systems approach.
Great, thank you for that, Pia. Mohammed, I think I'll direct this one to you. Has STAR been used anywhere else apart from healthcare?
Yes, it has been. So as I mentioned, there is a case study that we have done previously, which looked at occupational violence and aggression within the residential out-of-home care sector. So that was a great example that people can access now on our website, and shows how we've applied it within that context. But also in literature, similar methodologies have been applied quite a bit, and in a varied number of industries as well. And us as WorkSafe are also continuing to utilize that approach in a number of industries as well.
Great, thanks for that, Mohammed. And I've just got a note here that there is a link to that occupational violence and aggression bit that you're talking about there on the final frame graphic right at the end of this webinar, for anyone who's interested in reading about what Mohammed's talking about there. I am conscious of time, so I'm going to have to stop the questions, unfortunately, right there. Thank you so much to everyone who engaged in those questions. Anyone who had a question that I didn't get the chance to ask to Pia and Mohammed, please, if you need that answer, jump on the advisory line, utilise that and get that answer. I apologise that I was unable to get to all of the questions. It was great that we had so many being sent through. Thank you to both of you, to Mohammed and to Pia, for joining us today and having this conversation.
Thanks, Cameron.
No worries.
Thanks,
Thanks.
We are going to make a note on the screen shortly, a list of all the contacts that have been mentioned that you might find helpful. And as I said, also a link to that occupational violence and aggression report that Mohammed referred to. We are also going to, at the end of, or in the next few weeks, send out a survey where we'd love your feedback on any of the sessions that we've provided throughout this week, including this one via webinar. So if you could fill in that survey, it would be much appreciated. We are always trying to improve our messages that we get to you throughout WorkSafe's Health and Safety Month in October. So any feedback is much appreciated. If you have any requests for further information, we recommend you to get in touch. And remember, if there is something that you need to discuss urgently when you are back at work, please use the WorkSafe advisory line and the emergency line. Utilise those. Thank you so much for being a part of this webinar. Have a good day.